All the world has slowed to one, calm and low, internal hum, grace that moves us to the core, while we help them to be sure. Moving these words under my breath, like the sound of your heart as it beats in your chest. Eyes deep as a well, will I find success? Only time will tell. Oh, our hearts are there, where we help and love and care.
Oral maxillofacial surgery treats trauma, cancer, oral diseases, cleft lip and cleft palate. Dr. Lawrence Herman invited me to come on this trip last year for Smiles International Foundation in Tecate, Mexico. This is a total volunteer trip. There is no compensation from the Tecate patients that we treat.
We were only a short distance from San Diego, but it feels like we're worlds away, and they don't have the opportunities that kids may have, you know, an hour north of here. So it's a great chance to, you know, it's a surgery in 2 hours. We've changed someone's looks and hopefully their lives.
We've been coming here since 2005, 3 times a year, in this part of Mexico.
Basically, we're expected to provide our own hotel and to provide our own transportation to get here. I happen in my job to travel a lot, so I use miles to bring some of the nurses. 2 volunteers that we have doing instruments used my miles to get here.
It's helping people who have no access to care, to really good care.
She didn't have her nose done yet, did she? So, what do we look for?
Families, they frequently get on buses, sometimes as many as 500 miles away.
We got kids coming from Chihuahua and all the way south from Chiapas. So we reaching across the country. If they pay to a private doctors, they can reach up some of it, up to 100K.
The Rotary Club provides lunch and snacks for the kids because they're going to be here all day. We require the surgery patients to get here at 6:30 in the morning. And we have Rotary Clubs that drive them down. But the families then wait for those kids, and so we try to provide activities, playthings for them. We provide toothbrushes and toothpaste, teaching them how to take care of their teeth.
The preoperative evaluation of patients is very important to make sure that they don't have any medical problems that would complicate the anesthesia, to get a good, thorough medical history, to make sure they don't have any allergies or family history of medical problems, so that we can give them an anesthetic and a surgical experience that's as safe and comfortable as possible. Kid comes in with an obvious deformity that not only cosmetically causes problems, but impairs their function, their ability to eat, retarding their growth and development. And to be able to come in and spend just 2 hours or less repairing that defect, and that child's life is transformed.
At this clinic, we have this time 14 college students that are coming from a Rotary College Club called Rotaract. We have 4 nursing students from UCLA Nursing School and 1 nursing student from Saks. And one of them wrote an article about coming down here without all the bells and whistles of the technology that we have in America. I mean, what an experience for those kids. Hopefully a lifetime commitment then to volunteering in some way.
Well, I find that make the clinic to be very effective, you have to keep people focused. Because as you know, I'm always the one with the whip and get things going because we want to chat and
Explain your personality change. I do want to mention about the charting. There'll be a flow of the charts that originate with Maribel. Many of the patients already have a record. And one of the things you can look at on the record are little stickers on the front that says they've had surgeries at a certain number of times. And also when you're looking in there, make sure that there's a blank progress note to write on. I'm talking specifically to the screening docs. Each case that has a cleft lip and palate generally needs about 5 surgeries. And they need to be done at the proper time in their age of development and growth. So we monitor that with our record-keeping system and plan that ahead.
Well, the direct effects are feeding, number one, because when the child is born with this hole in their face, sucking is problematic. Number 2, speech. These children, because of the hole in their palate, are not able to swallow or speak properly. So they'll have altered speech patterns that require intensive speech therapy. Thirdly is hearing. All of these kids, because of the opening in their palate, have direct access into their eustachian tube of food and bacteria and so on. And middle ear disease is very, very common in these kids. And most of these clefting kids in developing countries will have hearing loss. Psychologically, it's a disaster. These kids that live in these villages and these small towns are really ostracized early in the game because they're considered outcasts or deformed. The families are looked upon as having sinned, or depends on the culture. You know, what country you're in, different religions, different cultures. They'll be introverted, they won't go to school, they'll be ostracized from the normal activities in the community. It's multifactorial, but those are the highlights, right, in a nutshell.
I have taken upon myself to teach self-esteem in the clinics where there's time is available for me to do so, for the children or the parents as well, because sometimes with a lack of education, they tend to make other ideas of what could have been the cause of the problem. So they need to be educated, and they need to be comfort and actually draw their attention to other beautiful things in life as well.
Cierra la boca, no mueve, tranquilo, tranquilo, no.
Abre un poquito,
Sí,
relájate.
tranquilo.
Maxillofacial surgery is actually a specific focus on the jaws, basically, the upper and lower jaws. It does include the eyes as well, at times, can include the nose, but generally a facial focus is really what it is.
She definitely will need some more surgery in her mouth, because not only did that deformity rather affect her lip, but it extended into her anterior maxilla. So she'll need to have surgery to correct that defect. But you can't do everything at, one procedure. We all wish we could do more, because there were patients that we, unfortunately had to delay, meaning they couldn't be done this trip. And so to turn them away is kind of sad. It really makes me upset.
I see so many of these kids that could be helped that just don't have anyone to help them. And the more I see them, the more frustrated I get. I mean, everything from equipment needs to donated supplies to people that don't want to volunteer when they could. There are many, many things. But, we live in a world of people. None of us are perfect specimens.
Diga Coca-Cola.
Coca-Cola.
That's good. That's good. He has good speech. So
Also, the other problem is follow-up care, which is very non-existent in third world countries. Unfortunately, some of the children can't be operated on because of the depth and the extent of their defects. The poor patients that we operate on, they usually don't have a dentist. There's no orthodontist, there's no audiologist, there's no speech pathologist, there's no social worker helping them on their path to recovery.
Last outreach, a sound evolves. Each new case unstruck, no bound. All we fear and all we feel, trust in one we hope is real.
This clinic was built by Rotary Club in 2006, and we built it in 1 year. And the Rotary Club spent about $600K, and that's in together with the USA clubs.
This clinic we built it because in the area, close to the area, there were no medical facilities. So many people die in the way to Tecate. So we decided to make some facilities for the people around here. And then whenever we had the whole building, equipment, with everything new, Jeff Moses contacted us and offered us to join him in Tecate. With the help of the Rotary Foundation, but mainly with the people that lives all around here. Some people donate their labor, some other donate the land, some other help us in building, some other give us some money.
Moving these words under my breath, like the sound of
We were in Costa Rica, and it was after a week-long craniofacial surgical clinic that we were doing at the Children's Hospital there, and then they took us up to a volcano, and the van lost its brakes on the way down the mountain road, and so we had a fairly large accident, and I was injured for quite a while, and then it kind of progressed itself into a point where I really needed to stop operating and turn my attention towards more focused teaching and maybe wear a different cap. Because the clinic is not used that often in between our clinics, and we were buying all the new equipment and supplies, and we wanted the sterile supplies to still be here at the moment that we arrived. We built a storage area and then have this ready for us, and it's got its own power system, etc., to keep all the equipment on power, because the battery operated backups on our anesthesia machines, the blood pressure units, that sort of thing, have to be charged and recharged all throughout the year. So this works out really well for us.
Dr. Moses has a philosophy that you just don't come in, do surgery, and leave, which is what happens in a lot of clinics. And that's great for the kids that you come in and do that. You repair the lip, you repair the palate. We've had kids, like for instance this clinic, that have had 7 surgeries.
All right, vámonos. I attended my undergraduate training at the University of Michigan, which is where I'm from, and then I attended medical school at Wayne State University in Detroit. I attended medical school on a military scholarship. I went to work for the Navy as an intern at Portsmouth Naval Hospital, and then spent 10 years on active duty at various locations, ultimately ending up in San Diego.
I'm an operating room nurse. I've been on surgical missions now for the last 20 years and have probably started 6 clinics from scratch. We've been in the Ukraine, India, Juarez, Ensenada, Tecate, Cabo, off the top of my head. I got involved in recruiting and training volunteers, and so for about 15 years now, I've been working with our different Smiles projects and helping organize with Dr. Jeff Moses the different clinics we've put together and making sure we have the appropriate supplies, instruments, and support staff for the surgeons who are doing the surgery. Meeting Jeff and being involved with his philosophy of clinics is one of the reasons I've stayed involved as long as I have.
I've been practicing in the Boston area since 1975. I went to undergraduate at McGill University in Montreal, and I did my dental school at the University of Pennsylvania and medical school and residency at Albert Einstein College of Medicine in New York City.
I became aware of children with cleft palates early in my career as an oral surgeon in Salem, Massachusetts. I went to Georgetown University. My residency was in New York City at Fordham Hospital Medical Center, and my didactic was at Bellevue Hospital, New York City.
Well, I'm from Maine. I went to Boston College for my undergrad, and then I went to dental school at Tufts University in Boston.
I work for a medical group called SCPMG that works with Kaiser Permanente in San Diego.
Larry always says that, a cleft deformity is like a highway. It extends from the lip, sometimes all the way back into the back of the throat. In Marco's case, he had already had his lip repaired, but his deformity also extended into the alveolus.
When I was a young surgeon in my 30s, I was enthralled with learning the procedures, with building my reputation, with having a few beers and chasing nurses at night and things like that. It was all part of the allure, but that changes over time. You can do that once or twice.
It really does have a bring her back. Ready to go. Yeah. Yes. Absolutely. Absolutely. Absolutely.
It's not that difficult. In 1982, not long after my residency years, I was invited as a young surgeon to participate in a volunteer program in Ecuador. And that piqued my interest. And it sort of fired my passion, if you will, to participate in developing country activities. And I set about at that point to come into contact with other like-minded individuals.
I was in the hospital one day and I bumped into one of the nurses, and we just struck up a conversation, and she told me about this great organization that was doing missions in Mexico. And I'd always been interested in doing something like that, so that's just the way it started. As the sole anesthesiologist, when you come to a completely new place, new operating room, starting from scratch, and you're learning as you go, that's one of the most rewarding things about coming on a mission like this.
There's a connection that one feels when you're with these children and their parents. It's a very good feeling that you're able to help mankind. And to be able to do it, as a volunteer group, even adds to that greatness of the trip.
I treated a patient in Peru a couple of weeks ago. The father that came in was 54 years old, and he never had his cleft lip done. He had an enormous hole in his face. He was married, and he had children. And when we fixed him, which he looked quite handsome, the wife could not get her eyes off him. It's amazing to watch the families react.
I think once you get on one of these trips, you get hooked in, and then you want to do these sorts of things the rest of your life.
In the old days, I wanted to see Bangladesh. I wanted to go to Nepal. I wanted to, go to Pakistan and South America. But I've been to all those places. I know how they look, and I know how they smell, and I know how I sweat there, and what the food is like. That part doesn't drive me anymore. But I'm driven now by the fact that these skills are so developed within whatever this body is that I have, that I can't put them to sleep. They need to keep being alive. For me, it was always developing different colors and different dimensions. And one of the things that I always found is that during the trip, I would feel just filled with energy and great feelings of love and service. And when I'd come home, the day I'd get home, I was almost depressed. I would feel awful. And for years I thought about this. Why do I feel tremendous while I'm on this trip, and then all of a sudden the next day when I'm home, I feel depressed?
Hola. Ay, puta nariz y otro labio.
It came to me that because of that week, what I experienced during that week was as close to the true loving experience that we talk about, that we write books about, that we dream about. We really don't know what it really is until it becomes part of your life. And then you feel it physiologically. And I realized that the reason I felt lousy on Monday morning was that all of that loving energy, that flow of service and not worrying about being paid or worrying about phones ringing, all of that was taken away. And you were just able to do what you do with love and allowing the skills that you have to come to life through you and not for you.
Que gracias a todos por tener ese corazón.
Thank you so much for all the volunteers and have such a big part. Welcome. So Carolina is sad because she's in here crying.
Your weak section of mucosa out, that's all going to come out. And now you're going to advance new mucosa from the sides into the midline. So this is going to come over to here, this way. This is coming over to here, this way. And we're going to take a piece of mucosa here, cut it down this way, and up to here, down this way, and then this mucosa is going to come to that mucosa in the midline. So we'll have that midline. This is down into the freedom area. We just kind of taper it as it comes down into the mouth. Take the wedge out. Well, then we have to determine before we cut the case whether there's muscles crossed. If we think there's muscle crossed, then we don't have to. But I always wind up taking it probably a piece out there and bringing fresh, making sure that we have good muscle crossing.
Well, let me be very specific about the etiology, or the causes, if you will, for cleft lip and palate deformity. Number one is genetics. In villages, particularly in Asia and in Africa, where the gene pool is weakened because of the inbreeding in those communities, the genetics play a role and there's a higher incidence because of the families are interbreeding with each other. Number two is environmental. Increased incidence due to the spraying of Agent Orange or dioxin, which is still being sprayed in Colombia to this day to eradicate the cocaine plants. But also DDT, which is still being used in the developing world, has been implicated in clefting. Prenatal issues are very important. Folic acid plays a major role in the development of cleft lip and palate deformities, as it does other neural tube deformities. And folic acid is very important for women early in pregnancy. The clefting deformity is complete in utero at between 8 to 11 weeks. So some of these young women in developing countries may not even know they're pregnant at that point in time. And they're certainly not getting the adequate folic acid in their diet. So nutritional issues play a major role. And there are other issues. Smoking has been associated with it. Certain drugs have been associated with clefting.
It's critically important that you have somebody with you that can suction for you so you can see better. So if we only had 4 hands, I think I'd be a better surgeon. Everything was really well organized. The ORs were clean. We had running water, flushing toilets. I can't say that for all the locations we've been in over the years.
The biggest challenge, I think, in the operating room, do you have the right light? Does the anesthesia machine work? Do you have a good anesthesiologist, the nursing, the equipment? And the second aspect is the political roadblocks that are put up along the way. We'll typically visit a town somewhere in Latin America or in Asia, and we'll go for 2 or 3 years and everything flows well, and all of a sudden there's some political change in mayor or governor, and somebody's nose gets out of joint that the gringos are coming in, and it shuts off.
Nursing is the toughest job I've ever done in my life. And when a nurse works 5 days a week, or even 4 10-hour or 3 to 12-hour shifts, you're tired afterwards. And so then to ask them to take their weekend or their vacation time, because if you're taking days off, you're taking your vacation time. To come down here is a lot. When you circulate, you're the one that works with the anesthesiologist to put the patient to sleep. You're the one that keeps a sterile field from people running into it. You're the one that gets the supplies when the sterile people need them. When you scrub, which is probably what I do more than anything else, you're the one that sets up the instruments, sets up the supplies, gets the local ready, has everything available for the surgeon. I actually hand them instruments and frequently hold retractors and stuff during the case.
We use a lot of stitches that dissolve over time, basically because there is no follow-up care, especially in Latin America and South America. So the stitches have to be self-dissolving.
The story I always tell that gets the team thinking, and I always tell them after a week of working like dogs and having emergencies and in situations that you have complications and you save some kid's life and when they're finally done and they're all sitting there at the end of the week, I said, you know what? Look around it. You said, these are people from all over the country. A lot of them didn't know each other before this week. I said, you can strip you all naked. Take everything away that you own, all your personal stuff. Wrap yourself in some scrub suits and you can go in that operating room and save someone's life. What is that? What does that really represent? It doesn't represent Seattle or Boston or Cincinnati and the house in the Hamptons. It doesn't represent any of that. It represents skills that have come to life within those individuals. And it has such value and such power that if you bring it to action, you change everything. You change the trees in the village that you're in.
Brought us together. Ooh, I need to give a love.
We are going to start the surgeries at 6:30 in the morning. At least we're going to be at the hospital at 6:30. And because of that, we were able to go ahead and get the cases rolling today. We're already ready and prepared. The nursing staff has already put together all the instruments sterile and all of that. The nurses, they are the backbone of this project. They are the ones that I want to give the highest recognition to. Thank you.
Fast outreach, a sound evolves. Each new case unstruck, no bound. All we fear and all we feel, trust in one we hope is real.
Well, there are really two main turning points, I think, in my life with regard to this work. One of the turning points was shortly after I had been invited to go on that first trip back in 1982. And I was reading the newspaper one day at my office, I'll never forget it, and there was an earthquake in Nicaragua around 1983 or something like that. And there was a little blib at the bottom of the page that anyone wants to volunteer, please call this number. I didn't think anything of it, and I flipped the page and I started reading about the Red Sox or the Celtics or something. And I have to tell you, about 10 minutes later, it was like I got an electric shock in my body. Someone said, woke me up, slapped me in the face and said, go back and call that number. It was a shock, and I did, and I called that number. And calling that number opened up doors that have changed my life. The second time, a patient came across the operating table that had a very different deformity. It was a cleft deformity, but it involved the eye, and it was a more complicated deformity, something that I really hadn't seen a lot of. And I had my doubts as to whether I really should proceed with this case or not. And the parents were pushing to have something done, and I did a sort of little meditative thing that I do, and I had a message that I should do the case. And quite frankly, when I started operating, it was as if some sort of a force was within me and moved my hands to make the cuts or draw the lines to where I was supposed to make the incisions. And And it was as if I was not really in control in a subtle way. I don't mean I was in a trance or anything like that, but I knew how I was, and I knew how I was different during this case, and it was a tremendous game changer for me because I knew at that point the case came out perfectly. I still see the kid today. It's 20 years ago, and the little girl's still in Bucaramanga, Colombia, and she comes and sees me every year when I'm there.
I think probably even from an early age, I was always instilled with a sense of duty and responsibility. And I went to a Jesuit high school where the motto was "Men for Others." And I'm involved with Rotary, which, you know, they epitomize service above self. So I think part of it is just this sense that I've been privileged enough and been trained by many great people before me, and so I have this skill set that is fairly unique, and that I have, as a result, I have a responsibility to use my skills to help those who are less fortunate than myself.
Well, it affords an oral surgeon who really wants to give, who has the ability, has the time to become a member, an integral part of a team. And the team approach is so important when treating these children with these cleft anomalies. And I think in the camaraderie, the connection, the spirituality of the team and the group is so important. And this carries on even with the children that we treat and the families. The rewards for coming on a cleft lip, cleft palate trip, it's a sense of giving back, it's a sense of connection with these children. What better way to continue our practice by volunteering on these wonderful trips to help these poor children who have cleft lip and cleft palate disease.
When you put a child into a mother's arms after you've closed a major deformity on that baby's face and or that young child's face, and you cry with that mother when you give them that child back, it is an experience that I wish everyone could do at least once.
¿Te podías imaginar algún día que esto iba a pasar? O sea, que ya...
No, yo pensé que se iba a quedar así.
No, I thought she was going to stay the way she was.
All we fear and all we feel, trust in one we hope is real. Moving these words under my breath, like the sound of your heart as it beats in your chest. Eyes deep as a well, will I find success? Only time will tell. Oh, our hearts are there, where we help and love and care. Ooh, our hearts, moving these words under my breath, like the sound of your heart as it beats in your chest. Eyes deep as a well, will I find success? Only time will tell. Oh, our hearts are there, where we help and love and care. Smile.